Uh, let's start this marathon. Please feel free to ask, to interrupt. The main topic is the practical education. So we are working on that since years. In Italy, we have made the first in 2012, and every year we deliver this occasion to learn to colleagues worldwide. Today, this morning session, first morning session, will be held by Dr. Vitale. Dr. Vitale is a quite good expert in lip injection. He really has gone deeper in the topic, and so hopefully you will find some new tips and tricks to use to your patients next Monday when you will start your practice, because this is the real aim of our IPAM Congress, really to change your habits since next Monday. So please enjoy your time, feel free to ask, and I'm afraid we must start because we are already quite late. Thank you very much.
I'm very happy to be here. It's an honor for me, and to be participating in this practical congress. So thank you to the organization for inviting me. So and thank you also, Alberto, for the introduction that you made. So this morning.
Wait, Massimo, because we need the screen open, because we do not see you on the screen yet. So
no,
please.
Not yet.
Okay, here we are. Proceed. You can go. Yes, yes.
Okay, so as I say, so today, this morning, I will take care about 3 sessions focused in the lower third of the face, specifically on the lips area and the perioral area. So the first patient, I will perform mix of techniques for the lips reshaping in a patient with thin lips. So thin lips could be very variable about the shape, so we need to approach them with a very precise technique in order to obtain a good result. So the patients, in this case, I will remove the numbing cream in order to start the treatment, in order to see the real shape of the lips, because the cream is hiding them. So the main goal here is to obtain a very nice result that it will be balancing the lips area with all the compartments of the face of the patient. So right now I will decide which technique I will use, and I will share with you this. So I don't know if you see very good the patient. Maybe the patient could sit a little bit, please. So the camera more up, please. So as you see, it's a young patient with a very good face. The shape of her lips are quite very nice. So very balancing, with a very good shape of the cupid bow, and with good balance of all the compartment of the lips. So my job here is to enhance and improve a little bit the volume of these lips without distorting it. So for this, I will use a mix of techniques. For me personally, I will perform a multi-point technique with a soft needle in order to be very, very less invasive. One thing that is good to remind when we perform a treatment is the correct knowledge about the anatomy, because specifically on the lips, the most important thing for me is the depth of the injections. As we know, the major vessels are positioning very deep. So in order to avoid a collateral effect like intravascular injection or for compression, is to perform the very superficial injection. So I will show you which is my technique preferred for this kind of patient. So the first thing, I will start to opening the box of the syringe. For this, I don't know if the camera can follow me, please. So I unbox the syringe. I will use the Restaurer keys. There is a very nice product with a very good balance of the chains of HA. It will provide a very good volume and a very good hydration for the lips area. It's a product that I like because it's very malleable, okay, and it can be used a 30 gauge needle that I love to use in the lips area. For me, it's better use soft needles and instead the 27 gauge needle. So I already mount the needle on the syringe, and I'm pretty sure to start the treatment. Please, if you, Alberto, if you want maybe ask something during the treatment, or anybody, please, no problem. So,
si vous avez des questions à poser, on pourra les poser en direct au Dr Vitale. Donc vous pouvez les poser en direct, il peut faire la démonstration et on pourra poser les questions.
I will perform two different techniques, because in this patient I will use a multi-point technique, because for the second patient I will use personal technique that I published, so I will show you later. So I am ready. As you see, the product is very let's say here, I don't know if you can see because it's a little bit distorting, okay, but if you see, the product is very soft, okay. You see the drop of the gel with any less pressure on the top of the syringe. So you see, we need we can do a very soft treatment without much pressure of our hands. So for me, this is important for a product that provides me that kind of feeling in my hand. So I will start the treatment. This patient is very, let's say, is very easy because she doesn't have so much necessity of her lips, but obviously we are here to work on her, and the main goal is to improve the shape of her lip. So for me, it's very easy. The first injection that I will perform will be in this area. So I will probably I will use the same access point to improve the cupid bow and also add some little bit volume and projection of this area here. I always like to work with the bevel up of the needle, because I want to have the product very superficial. So we'll start, okay? Perfect. So
Dr. Vitale, sorry, which gauge do you use for this
first
patient?
injection here, little pinch, sorry. And you see, barely, if you see the needle is very superficial. So this this image allows to us to be very safe. We are avoiding major complications. So
Dr. Vitale?
yes.
Sorry, which gauge do you use for this patient?
30,
Which kind?
30 gauge.
30 gauge, okay.
Yeah. If you see, I am doing some trading
Une gauge de
technique.
30 gauges pour cette patiente.
Sorry?
I just translate.
As you see, I'm using the same access point in order to have the definition of the Cupid bow, releasing tiny dots of the HA gel. And if you see, with the single access point, I was able to reshape this area. We almost doesn't have bleeding because we are very superficial here. Okay? And the amount of the HA released is very, very small. Okay? We perform the second access point here. Always trading, always moving. And you see same access point here. Using this, we can define like the pillars of HA, trading, building like a bridge. So the product is positioned very, very superficial, and it has a very good definition of the vermilion border. So in this way, we are adding volume, and we are adding not only volume but also projection and the eversion of the lips mucosa. And if you see the treated side with only, I think, 0.05 of product in two different access points, we was able to improve the lips area. So, in my opinion, we don't need to be aggressive in this area, because with simple access point, with tiny drops, we are able to improve this area and obtain very good results. So, as I said before, this is a multi-point technique, and I will perform the third access point here. You see, the depth of the needle is very, very important. And I am doing a retrograde fanning technique. Same access point here. Okay. How you feel? Good? Okay. We don't need a strong massage because the product is very, very, very soft. So we can just a little bit of pressure, and then the product will be distributed in a very good way. So in this case, I prefer to not treat the lateral part of the lids, because I don't want to elongate this area, because it could be not so aesthetic good result for this patient. So I perform 1, 2, and 3 access point. Maybe I will perform a little bit here, and I will stop here. Okay? A little bit here.
Dr. Massimo.
Yes, sir.
Okay, now that you have almost ended this side,
Yeah.
please, we will be delighted to see you doing like you are in your office on the other side, so we can appreciate the way to do it, the timing and everything. Okay?
Okay?
Thank you very much.
You want to see the patient seated? I don't know.
The patient seated could be excellent to appreciate the result. Thank you. With a bit of zoom, please, because we need some zoom to see the lips.
On voit déjà un petit peu le résultat. De loin.
As you see, Alberto, as you see, with the very
Excellent.
superficial injections in a very safe area, we are we have two major things here. The first one is that we have almost no bleeding. The chance to have bruising or hematomas is very, very low. And you see, obviously, that the chance also to have the migration of the product is also very, very low. So you see, I use almost 0.1 ml of the product, so nothing, almost nothing, just to improve the shape of this side of the lips. I think at the end of the treatment, I will able to use a half of the syringe. Obviously, in this patient, she doesn't have so much of necessity. Obviously, it depends also of the taste, aesthetic taste of the patient, what she wants to look, but she doesn't want to a very strong result on her face.
Of course,
okay?
Like every patient, I suppose.
Okay.
Okay, show us the other side like you are doing in your office.
Perfect.
So no explication, just to let us appreciate how we are supposed to proceed if we want to simulate your technique, okay?
Yeah.
Thank you, dear.
So, sorry here. Okay. So, the same from this side. I'm entering from the top of the cupid bow, and I perform also here a fanning technique. Okay. Then immediately another point here, and you see without exit of the access point, I am trading could be a trading treatment with the like a lifting lip, you know. Okay, the third point here, you see, is very, very superficial. The choice of the product here is crucial because we need a very soft product in order to accompany our hand to do this kind of movement, because we need to be very gentle in this area. A little bit of massage could be useful to obtain the distribution of the product, and a little bit here last. All right. Now I will change little drops here. I will change the needle because I always love to work with a sharp needle, so I will change the needle with a new one and do some pinch injections in the lower lip, mostly in the central part of the lips, because as I said before, I don't want to elongate this area, just to give her support to the upper lip. So, here is very important. In my opinion, I need to avoid this lateral part and give the support in the central tubercles of the lips. So, also here, for me, it's very important to be very superficial, because also here we need to pay attention of the anatomy, avoiding deep injections. Obviously, if we want a lot of volume, we need to do injections behind the muscle, you know. But there are very risky injections because of the vessels. So, for me, I prefer obtain this kind of result. The position of your hand is very important also, so ask the patients to be here. So I need to have a support of my hand, my arm, sorry, okay? Okay, little bit open here and a little pinch. Thank you. So I don't know if you are seeing good because I am in the back of the DP. Can you see? No, I think you don't see very good. Sorry, Sam. Okay, perfect. As you see, I am focusing in the central part, and obviously I can use this access point in order to avoid here more access, and moving like a thread. Okay, little bit of massage from the inside to the outside in order to give a little bit of projection. Okay, yeah, perfect. So I will finish because it's time to move to the next patient. Okay, and another point here, and we are finished. And I will show the result. Little bit of massage. Oh, she looks very nice. Please sit. You are good?
Yes.
Okay. Very, very nice. You see the result?
Yes, we need a zoom on the lip, patient's lip. Oh, great.
Very, very nice. Very nice. So, thank
Very
you so
good.
much. Please look yourself at the mirror right now.
Est-ce que vous avez des questions pour le docteur Vitale par rapport à cette présentation? Oui. Micro, s'il vous plaît. Faites, s'il vous plaît, un micro. Faites.
So, remove the cream.
S'il vous plaît, désolé de vous demander ça. On s'est donné la peine de mettre de grands écrans, que cette partie regarde là-bas et que celle-là regarde ici, pour ne pas gêner vos voisins, ceux qui sont devant vous. On s'est donné une grande peine pour faire cette disposition. Désolé si ça ne vous plaît pas, mais on est obligé de respecter comme ça vous ne gênez pas les autres, il y en a qui se plaignent, etc.
Il y a des questions ici.
Oui. Alors, bonjour tout le monde. Une petite précision, en injectant, est-ce qu'on va arriver jusqu'au le bord inférieur de la lèvre ou juste la partie centrale? Il faut s'arrêter.
Thank you.
Dr Vitale,
Yes?
there is a question, please. One doctor asked about how deep you are. Are you in the middle of the lips or you are
I am very, very superficial.
very
Very
superficial?
superficial.
But you inject all the lips or just
La partie centrale.
I inject mostly the central part of the lips in this case, avoiding the lateral part, but I am subcutaneous, let's say, because the vessels are very, very deep, so we need to avoid, if we want to work with safe techniques, we need to are very, very superficial. In my opinion, I like to work in a relaxed mode.
Well, yes, but you inject all the area
Yeah,
or just the superior part?
I inject, let's say, at the middle.
At the middle,
At the
donc à la
middle.
moitié. Donc il
Yeah.
injecte, le docteur Vitale injecte jusqu'à la moitié. Donc quand il rentre avec l'aiguille, il ne va pas jusqu'au bord libre de la lèvre, il s'arrête au milieu. C'était ça, je pense. la
Oui,
question.
oui,
Yes,
c'est
thank you, thank you. There is another question, I think. Yes.
Please, for Dr. Vitale, I have one question about the risks of this injection. Risk
Okay.
for the injection in the lower and the lips.
Can you, because
The risk, what is
The
the
risk.
problem if you inject about the vessels and what you
Okay.
don't have to do when you are, injecting
okay.
a patient?
Let's say the risk are
Precautions.
major risks are in the intravascular injection, so to have necrosis and ischemia, and obviously it depends also in the amount of the product that we are injecting. We can have also the compression of the product. But if you add a lot of volume very deep, you can have not only the compression, but if you are very unlucky to inject in a vessel, so could be very risky. So for me the safety is the principal thing. So if I am very superficial in the layer of the lip, I am pretty sure that I am avoiding major complication. Obviously, we have some anatomical variations of the passes of the arteries, you know, but it's in this layer is only the 3% of the cases. So it's very extremely rare. So if I am injecting in the superficial layer, I am pretty sure that I am very safe. Not safe, but safer, you know.
Okay.
So.
Alors l'injecter, donc il injecte superficiellement, même s'il a 3% de variation anatomique, vous pouvez entraîner une nécrose par compression ou par injection directement dans un vaisseau. Ça peut être les deux. C'est pour ça que plus on est superficiel, plus on est en sécurité, c'est plus sécuritaire pour les patients. Pardon, une autre question?
Dr Vitale, we have to be on time.
Okay.
Sorry.
Sorry.
Next patient.
Alors on passe à la deuxième patiente, on aura l'occasion de poser d'autres questions. On a commencé par la lèvre fine, là on va aller sur l'autre versant qui est donc la lèvre beaucoup plus charnue pour voir un petit peu le panel de la prise en charge des lèvres de la lèvre fine qui est un réel challenge pour nous, pour ne pas avoir les lèvres en bec de canard et aller vers une lèvre plutôt plus épaisse, plus charnue et l'embellir sans être dans le over.
Alors vous savez tous que la lèvre fine est la plus difficile. Ceux qui travaillent déjà le savent. Et donc, il vous a montré quelques astuces. Et ce premier workshop a été sponsorisé par Restaurer. Je présume qu'il y en a beaucoup qui injectent Restaurer ici. Donc, je les remercie. C'est Galderma pour leur logo. Mais c'est en fait le produit, c'est Restaurer. Ils vous l'ont montré au début.